Do women have increased risk of development of thyroid? Yes, they do have it. Hello everyone, this is Dr. Jayaditya Ghosh, consultant endocrinologist, Yashoda Hospitals Malakpet. So women do have increased risk of development of thyroid problems in form of hypothyroidism. Why is it so? It is because these females have an increased risk of autoimmune disorder, and hypothyroidism, that is Hashimoto's thyroiditis developing hypothyroidism, is one of the leading cause of development of hypothyroidism. Other factors also play its part in that. If the females also having a family history of mother having the hypothyroidism, then the risk of her developing the hypothyroidism is also more. Other being nutrition deficiency. Females may have iron deficiency, that is also one of the cause of developing of hypothyroidism. So all these factors play its part in development of hypothyroidism more in females. So why do the females need to have a proper thyroid function as compared to the males? Both males and females do need to have a normal thyroid function, but thyroid plays a more important role in having a normal periods in case of females, that is normal functioning of the gonadal axis. If a patient having a hypothyroidism can lead to development of irregular cycles in females. So if they do not correct the hypothyroidism, they may miss cycles. Therefore, it is more important. Even for pregnancy and conception, thyroid is very much essential, and therefore hypothyroid needs to be treated adequately. Therefore, in the females, we need to have a proper thyroid function for normal menstrual cycles as well as for conception and pregnancy. Apart from the other functions of normal hair growth, having a normal function of the body as well to decrease the fatigue and lethargy functions as well. Therefore, we should take thyroid properly, and every female who have any of the symptoms of hypothyroidism should be adequately treated. Thank you.
Like, comment, and subscribe for more health updates.